When it comes to your retirement, do you want to have the same old plan everyone else has? Of course not. You're unique and have your own goals and dreams. Don't be treated just like a number. This is your retirement. So it's time to think differently. And you're in luck because you've found the Retire Your Way podcast with ILG Financial. At ILG Financial, you won't find generic, run-of-the-mill plans containing the same old cookie-cutter solutions. Dave Chase and the ILG Financial team focus on building one retirement at a time using their Think Differently philosophy. And that means your own comprehensive plan with customized solutions built to achieve just one goal, yours. So put on your Think Differently hats and get ready to take back control of your retirement today and for all the tomorrows to come. ILG Financial's Retire Your Way podcast was created just for you, and it's starting right now.
When it comes to retirement, do you want to have the same old plan everyone else has? Of course not. You're unique and have your own goals and dreams. Don't be treated just like a number. This is your retirement, so it's time to think differently. And you're in luck today because you found the Retire Your Way podcast with ILG Financial. At ILG Financial, you won't find generic run-of-the-mill plans containing the same old cookie-cutter solutions. Dave Lopez and the ILG Financial team focus on building one retirement at a time using their Think Differently philosophy. And that means your own comprehensive plan with customized solutions built to achieve just one goal, yours. So put on your Think Differently hat and get ready to take back control of your retirement today. And for all the tomorrows to come, ILG Financial's Retire Your Way podcast is created just for you, and it's starting right now. Dave Lopez is here, of course, of ILG Financial, and we have a special guest today. Alex Sieler is here, and we're going to talk about Medicare. So I'm going to get out of the way, guys, because I'm really looking forward to hearing what you guys have to say about Medicare and Medicare planning.
Hey, Ron, thank you very much. I love that introduction. This is a little weird. I feel like I'm taking your spot today by being the one who's asking the questions of Ron. But, you know, I'm a big advocate of know your lane, if you know what I mean. And Medicare is not our lane. Our specialty, as you know, is the retirement planning space. Medicare is a big part of that. And we know enough to make sure that if we're not experts in the field, that we have an expert in the field. And I'm so happy to introduce everybody listening to Alex. Alex has over 15 years in the Medicare insurance space. His firm is called Precise Insurance Advisors, and they stretch, Ron, over almost every state in the U.S., and the last 3 years, they've been recognized for their client retention and, most importantly, their customer service. Alex is focused on Medicare specifically, Medicare and health insurance, but he's also supports his clients with insurance such as cancer, critical illness, dental, heart attack, stroke. Did I get that right, Alex?
You did. Thank you.
I did. And I will tell you, I'm so thrilled to have you here on the podcast. And I wanted to tell you, we've talked about this before. We still feel so fortunate to have you on the ILG team and the ILG family as one of our trusted partners that we have access to, and our clients now have access to you. So thanks for being part of the team, and you just open up a world of resources for the clients, because what we'll talk about today is what we talk about a lot, Ron will admit to that, is this idea that I don't know what I don't know. So what I'd like to do today with you, Alex, is we're just going to let you talk about what you know best, but I've got some specific things that I think our clients and the folks listening would like to know. So if you don't mind, I'm just going to kind of jump right into it. Tell me what's going on the horizon for the rest of this year, 25 and 26, with respect to Medicare planning that we need to know about.
Yeah, and again, thank you for having me. So yeah, Alex Sieler, Precise Insurance Advisors. Been doing this for a little over 15 years, and you know, I think for all the listeners out there that are on Medicare, you're aging into Medicare. I think everybody can agree it tends to get a little noisy, right? A lot of phone calls, emails, texts, letters in the mail, and it can be a little over the top. And it's one of those things where it can confuse people. Terminology is maybe misused, whatever it may be, to get people to pick up the phone and interact with, you know, somebody who is sending out that kind of content. And the fact of the matter is a year like this year, it is going to be extremely important for really everybody, whether you're getting onto Medicare or especially those already on Medicare. When October 15th comes through December 7th, make sure you're taking the time to sit down and truly do a review on your coverage, your benefits, and make sure all the I's are getting dotted and T's are crossed. That'd be the biggest thing I would talk about today.
And Alex, that's a great point. So just to make sure, I'm going to back up a little for folks that might even be new to Medicare.
Yeah.
Walk them through what you're talking about this annual open window. Is that how you refer to it?
Yep.
So talk about exactly what that is, why that's so important to folks in Medicare, and why they should relook at things every year.
Yeah. So for those that are maybe getting on to Medicare already on it, you have your Part A and you have your Part B. Part A is your hospital, Part B is your doctor, and that covers about 80% of your Medicare coverage. To close on the other remaining 20%, many of you have heard that referred to as like Medigap. You've heard that referred to as the donut hole. Really what that is that remaining 20% is when you do work with someone like myself or agents within my company or other agents out there in the community to cover that other 20%. And when you do that, there's really two different paths to take. You can go a Medicare supplement, standalone prescription drug plan route, or you can go with what they call the Medicare Advantage route. And annual enrollment period is October 15th through December 7th, and that is really aimed at those that are on prescription drug plans or Medicare Advantage plans to do an annual review. If it's necessary, make a plan change, whether it's within the same insurance company, a new insurance company, different type of plan, go from one side to the other, whatever it may be. It's a time for where everybody can make a one-time change for January 1st of the following year.
So Alex, every year, everybody in Medicare gets the chance to switch plans if they choose, correct?
Exactly. Absolutely.
You could switch to different Medicare Advantage plans if you're on Medicare Advantage. You could switch from Medicare Advantage to Medicare Supplement plans, or the other way around, correct?
Correct. And the only thing I think another thing that maybe what we hear is I don't know if I would like to say confusing, but something that just people question a lot is, let's say you want to go from a Medicare Advantage to a Medicare Supplement plan. That does require what they call underwriting, but yeah, it's still a time that during that time when you can make that change. So yes, you nailed it on the head.
But you do have the opportunity, and a lot of folks weren't aware that they would have the opportunity to change. So, have this risk of somebody maybe getting on a plan because they talked to somebody and helped them get on a plan when they were 65. They may be 70 now and they've never considered changing and didn't know that there's a better fit for them.
Yep,
right,
absolutely.
Right.
Yeah, and to your point, I think the reason why a lot of times people don't make a switch is because of all the marketing and I mean, it's a lot for the folks listening that are already on Medicare. You know exactly what I'm talking about. You get the mailbox, letters, emails, phone calls, text messages, and I think what it does is over time it just numbs people to wanting to focus on it, if you will. And when in reality there is an important message behind there, which is kind of why we're on this podcast today. It's finding yourself a trusted representative that is truly agnostic to helping you make sure you're fighting the right needs and health coverages for yourself.
Yeah, and I appreciate you saying that. And you're probably not going to blow your own horns, so I'm going to do it for you. And we are so happy to have you working with us. There's a huge difference. A lot of folks out there might sell Medicare plans, but their model is, hey, I'm just looking for new customers. And once they sell it, they're hoping you're just going to renew every year. And all their efforts are spent finding the new customers. What I like about what you do, Alex, your model is a lot like ours, which is once you get a client, you feel this obligation to continue to give them the highest level of service year after year. And that is very time consuming compared to a competitor who just doesn't look at them again and hopes they renew. Is that right?
Yeah, absolutely. Absolutely. It's not just getting you on your plan, but also making sure that, you're what we call the retention effort and the customer service effort, making sure health changes all the time, right? When it comes to healthcare, and it's not a one size fits all, and it's a constant moving target, if you will. People's health changes all the time. They get sick, they get healthy. And so it's important. And with that, your coverage needs change. And that's what the importance is with needing to get that proper evaluation.
And the difference that you see is I'll talk to clients who are on Medicare, and I'll ask them, hey, who was your contact? Who's helping you with the Medicare? And I will tell you the overwhelming answer I get is, I don't even know. It was like 4 years ago the guy got me on it. I don't even remember how to contact him. Whereas with your firm, since you're actively engaging these people to make sure every year they've got the right plan, you're not seeing that. These folks know exactly who you are. They know you're engaging to make sure as their life changes and their medical situation changes and the Medicare landscape changes, that someone's out there shopping to let them know of other options. Is that correct?
Correct. Yep. Nailed it.
Yeah. So listen, I appreciate what you do. So tell me about, let's get back to that what's going on this year. You said there's always changes on the landscape. Specifically in 25, 26, as far as regulations or just changes to the plans, what do you see that makes this year a little more volatile maybe?
Yeah. So, something I always say is, I don't get into politics with clients, customers, other colleagues, whatever it may be. But, the reality is, and this is where we tell people all the time, not for better or for worse, it's just different. Medicare insurance is just different. And it's because it's really because you have to have it at some point in time, right? And, everybody, as you got paid throughout your life and your career, we saw it on our payroll stamps, right? That, your Medicare deduction, your Social Security deduction. And that's what this is all about. And as much as we don't get into politics, the reality is Medicare is very politically driven. Every year, changes happen all the time, whether it's, the financing of Social Security, Medicare, and how this all works. And man, we could spend hours on this topic. But if I had to really just sum it up, and I'm the first to say it, there are changes that need to be made for a multitude of reasons, good, bad, indifferent, whatever it may be. And this year, it's like they are our folks over there at the Social Security office, CMS, Centers of Medicaid, Medicare Services. That's who's the governing body of Medicare, and basically writes the rule book of how agents like myself and others out there can market insurance Medicare products. It's like this year they're going, okay, we really need to make some shifts. Something to note is we're at year one of, I believe it's the next 3 to 4 years of peak individuals aging into the Medicare space. Right. The baby boomers are coming in. And I think what they're recognizing is there's going to be a major uptick from the 33 million that are already on Medicare today to the people coming on board. And so there's a lot of shifts happening. And if I had to really sum it up here, both paths, Medicare Supplement with the prescription drug plan or Medicare Advantage, are both going through their own changes, which is really what's quantifying the big change this year and next year. It's not just 2025, but it is also 2026 compared to previous years.
And as far as the listeners, right, how that affects them is, you had told me off air that you think you're going to see more than the normal amount of plan redesigns, right?
Yep.
And some changes to who gets what the networks look like for your plan and what the carriers are accepting as far as coverage. Well, that's huge for the people on Medicare who don't know that those changes are made with their plan.
Yeah. So, something to note is, Medicare Supplements is a little bit of a different beast from Medicare Advantage. Medicare Supplements is not network-based. That's one of the big perks to our Medicare Supplement products it does have a monthly premium, right? And as we tell people, you're paying for it regardless if you use it or not, but you're not going to pay any more or any less than what your monthly premium is. And then on top of that, there's no network. So whether, you're in Florida, come see me in Nebraska, you're on your way to California or somewhere in between, and if you're to use your Medicare supplement plan, as long as the doctor accepts it, you're covered. And that's probably a big pro to it. Medicare Advantage is that network-based insurance. It's kind of a pay-for-it-as-you-use-it type service. The networks are very broad. It's actually much easier today than it was just 5-10 years ago. Again, let's say you're a resident of Florida and you're on an Aetna plan. If you were up here in Nebraska, even though you're on Aetna, you were technically out of network. Well, now they've kind of changed that. If you're in Florida and you're up here in Nebraska, there are instances where you're still considered a network. So that's a really cool thing that has shifted in the Medicare Advantage landscape. But something that is a reality with Medicare Advantage is does your provider accept it? And that right there is a topic all in itself. I think that's a big confusing part about Medicare Advantage is people go, Dave, I have this plan and I don't know if it works for me or not. Well, the number one thing that we see, it's like, well, you know what? You're on this Aetna plan, but your doctor doesn't accept it. And that could be the big confusing part. And that's what we really, whether it's someone going on to Medicare the first time or when we do their evaluations, that's one of the most critical things we look for is who are your doctors, who are your specialists, what hospital do you prefer? Let's start there.
You're
and then we
listening
work
to
down.
the Retire Your Way podcast with Dave Lopez of ILG Financial. Income, legacy, growth, it's all right here at ILG Financial, and it's about helping you plan for retirement your way so you can achieve your financial goals. Call ILG Financial at 540-720-5656, or, of course, you can go online to ilgfinancial.com to learn more. Now, back to the Retire Your Way podcast with ILG Financial's Dave Lopez and a special edition of the show today talking about Medicare with Alex Sieler. Now, back to Dave and Alex.
Thank you, Ron. I want to get back on that point you just said, Alex, because I think that's so key, this idea that there's two different ways to take care of what Medicare doesn't cover. And if I'm hearing you right, Medicare Advantage plan is really more like the traditional health insurance people are used to having, correct? You're just signing up with a company and they're covering everything as opposed to Medicare covering it. Is that accurate?
Yep.
So just like when you were getting health insurance all your life, you're looking for, hey, is the network good based on where I live? Is it going to do a good job of covering what I want to cover? And so you're going to shop the same way you've looked for health insurance your whole life. Make sure your providers are in the network. When it comes to Medicare supplement, it's all through Medicare. The difference is the supplement plan, if I hear you right, it just pays the bills for that 20% you talked about at the beginning of the podcast that Medicare doesn't pay for. Is that accurate?
You got it. Yep, that's a good way to look at it.
So it really, you did a great job of explaining that. So the takeaway here is which one's best for me, which is what a lot of our clients say. And the answer is you really need to get on the phone with Alex because it is going to be different for everyone depending on your medical conditions, where you live, the amount of times you go to the doctor, what medications you're on. What's the difference in cost?
Oh, boy. So,
I gave you the can of worms, didn't I?
Right. And it actually kind of goes back to even, different things I always want clients to look out for. So what's the cost? At the end of the day, whether you are choosing a Medicare supplement plan, a Medicare Advantage plan, what's the cost? The best way to answer that is how do you view your health care? When Dave, when we work with a client for the first time ever, whether they're new to Medicare or existing, we actually go through the re-education process or the education process. We have a Medicare 101 that really, it's a very easy read PowerPoint for people to read and kind of re-coach them on the 4 parts of Medicare. And, what's it cost? Well, the way to look at it is they all cost, believe it or not, it gets to a point where for the average Medicare beneficiary, they all kind of cost the same at the end of the year. That's one thing that I think really kind of strikes people different because Medicare supplement, you're paying for your monthly premium. That's how it works, paying for your monthly premium every month, no matter how much you use it. Medicare Advantage is more of a pay for it as you use it. There's co-pays, there's deductibles, and again, that all kind of adds up, right? And so what it costs is kind of what I would like to say, there's really not a clean answer for that.
Yeah,
but at the end of the day,
happens, right? It depends on what
exactly
happens during the year. Yeah, so you're taking a little chance, just like someone who's getting 2 insurance policies, and one maybe has no deductible and copay, and one has a $5,000, out of pocket, right? Which one's better? Well, I'll tell you at the end of the year, depending on if you have to go to the doctor a lot.
Yep, and it changes all the time, right? I mean, we see this. I actually just had this the other day. A client of mine. She has been on a Medicare supplement plan for about 5-6 years. Her rates have gone up, but her health has changed, and it's just at a point now where it makes more sense for her to go to a Medicare Advantage plan. just a couple days actually before that, had a client say, Alex, I want to get an RV, and he's a big sports fanatic. He wants to follow college game day, college football this year. And believe it or not, he was thinking about his Medicare, and he's going, I think I may want to switch from a Medicare Advantage plan to a Medicare supplement because I'm going to be living out of my motor home and I need to be able to have that flexibility. So not only does your health change, but your lifestyle changes. And believe it or not, that's everything that we want to take a look at as you are in your Medicare years and do, again, those annual reviews. Dave, I'd say we do what we call retention calls, customer service calls, a minimum of 5 times a year with the client. And one of those times being during quarter 4. But as we tell our clients all the time, call us. If you ever have anything, just so we can talk through whatever it may be, because it's just important, right? It's very important.
Well, you're right, and it's just like what we do on the planning side is we tell folks your plan is literally a living document that's going to continue to change, because the only thing I can guarantee is I don't know how your life's going to play out here in the next 10 to 20 years. So the result is we have to continually be getting back together, looking at where we are now and making adjustments to the plan. And I can't think of a place where that's more important than this Medicare space. And it's, I would say, the biggest hole in folks' plans on the health insurance side is they just don't know that you don't pick a plan and then that's it. You just kind of stay with the plan. If it's lousy, you kind of deal with it. And I'm really glad you got to share this with us. You know what I want you to do, if you don't mind, Alex? Share that story you and I were talking about your client in Nebraska, because I think it's very illustrative of the whole I don't know what I don't know.
Yeah, so for your folks listening, if we've not talked before, I live out of Nebraska. I'm based here out of Omaha, Nebraska, the good old, the flyover state, whatever you want to call us, right? The corn is our ocean, as we like to say. And the thing about Nebraska, which is a very interesting market for Medicare, 80% of Nebraska's population is in 3 cities, and it truly is all along the east coast of Nebraska, Omaha, Lincoln, Grand Island. And the rest of that state, you go completely west out to the Panhandle, everything. It is very, very rural. And what, Dave, you're talking about is one of my clients. She's out of McCook, Nebraska, which is out of the southwest part. I actually think I said that to you wrong the last time. Now I'm thinking about it, but it's out of the southwest of Nebraska, very rural area. And this individual, she has just been on Medicare. She's actually healthy, but she's been on the same Medicare Advantage plan with a particular carrier for nearly about 6 years. And when she got on it the first time, it made all the sense in the world based off of her health, how often she was going to the doctor, and where she lived. Well, unfortunately, and she would admit it right now if we were on the phone, she's just kind of neglected all the phone calls, emails, people reaching out to do a review because she didn't know what she didn't know. Well, come to find out, and she just thought, well, I'm getting older, costs are going up, inflation's going up. No, it actually just got to a point where the plan she was originally on, it just wasn't the best fit anymore for changes at the carrier level, things of that nature. And so, yeah, I was able to sit down with her. Her son is the one who helps her with her finances, the one that looked at him and goes, I just don't know if this makes a whole lot of sense. And he called in. I wish I could remember exactly how he got in contact with us, but he called in, and I happened to answer the phone. He said, do you guys do free consultations? I would just like somebody to take a look at my mom's plan and tell me what's going on. I said I'd be happy to. Kind of went through my process with them. And when you work with us, I would say from talking to you initially, getting the information we need, reviewing your options, and making a change or not, I would say on average, we're getting that done about an hour and a half to 2 hours, maybe over a span of 1 or 2 meetings with our clients. And anyway, it took me 30 minutes to realize, oh my gosh, yes, we absolutely need to make a change for his mother. And like I told you, we saved her, close to $9,000 a year just in her prescription costs, and co-payments, right? And that's, that was huge for her. That was absolutely huge for her. And it's, like I said, we saved her that amount of money, and it probably, in all reality, took me about an hour to get all said and done.
Yeah, so that's a great example, which, if I'm hearing you right, the big takeaway is it is imperative that this stuff be reviewed yearly by somebody who, and here's another difference, right? Someone who doesn't work for one company, right? Because if somebody works for one company, their job is to pitch their company's plans, not to kind of look impartially at all that's out there in the Medicare space. So you need somebody who's got access to many companies, and you're over 40, if I'm not mistaken. Is that right, Alex?
Yep.
So over 40 carriers, and you don't really have a dog in the fight, right? You're just looking for the best fit for the client. It doesn't matter which one you pick, which puts your clients in a great advantage because they know you're not trying to push one plan or the other. But the big takeaway I get from this is this needs to be reviewed yearly as their health changes, as they might move, the location changes. Any changes in lifestyle or health is going to be a reason to have this reviewed, and that's what you do for all of your folks.
Absolutely. Yeah, so, even if we do an annual review, it doesn't mean we automatically make a change. And that's, if I think you refer to it as, toot my own horn. I certainly I'm not the type necessarily to do that, but for us, if I had to lean one way of why work with someone like us over the other, something we see with a lot of clients, and it's advertisements, right? Those are very powerful. People see advertisements for United Healthcare, Aetna, Cigna. They talk to a friend who goes, hey, what plan are you on? What company are you with? And they say, oh, this is great for me. I'm with this carrier, this particular plan. And it doesn't work that way, right? It's not a one size fits all. And the difference you get working through someone like myself versus calling into an insurance carrier directly, if you call Aetna, if you call Cigna, you call United Healthcare, Humana, one of these carriers out there, the people that pick up the phone to do an evaluation and possibly put you on a plan, they only know their products, right? They only know Humana. They only know Cigna. We work with all of them. Right. And so you're not going to spend any more, any less. We all represent the same stuff. The difference is we are what they call independent, and we are truly agnostic to both product types, Medicare Advantage, Medicare Supplement, as well as agnostic to our carriers. And that's what clients like, because they know when we do our evaluation, we show them everything that's available at their fingertips.
And just to point out, there's no fee to work with you.
Nope.
So it doesn't cost any extra to have an impartial independent who has access to everybody as opposed to calling a company direct. So there's really no reason not to have an advocate like Alex on your side. So, hey, Alex, thank you for the time. For anybody listening, clients, everybody listening, the takeaway from this is if you have a representative, an independent representative that's helping you with your Medicare, and they are reaching out to you a minimum of once a year to make sure that you're still on the right plan and reevaluating year after year, then this is a great podcast to let you know, hey, you're on the right track. You've got a good person there, and you want to take advantage of those yearly reviews. If that's not happening, we highly recommend you get with somebody. Alex is an excellent choice. If you want to get in contact with Alex, just call the office. Ron will give you the information. We'll pass your name on to Alex, and he'll be glad to get with you. He works with any of the clients that we send over. He does a wonderful job, and he's glad to help. You don't even have to be a client with ours. Is that right, Alex?
Yep.
Right. We'll just pass them off. So give the office a call. We'll pass off that information. You can get in touch with Alex. And for nothing else, just get a confirmation that you're on the right plan. If you meet with Alex and he confirms that he wouldn't change anything, goodness gracious, that's worth the phone call. So that's my tidbit. I'm glad you got on the call, and I sure appreciate your partnership with ILG Financial, Alex.
Absolutely. Thank you so much for the call today, and happy to be here.
Alex Sieler, thank you so much for being with us today. Informative conversation. Dave Lopez, good job. We all learned a lot with that conversation. Now, if you'd like to get in touch with ILG Financial, here's the number to call, 540-720-5656, or go online to ilgfinancial.com to learn more about Medicare or any other topic related to you and your retirement. You're one step closer to learning what a customized retirement strategy can do for you. And we appreciate your listening today to the Retire Your Way podcast, brought to you by ILG Financial. The information provided is for educational purposes only and is not intended as investment advice for any individual or entity. All information contained herein is believed to be from reliable sources. However, we make no representation as to its completeness or accuracy. The views presented today are those of Dave Lopez and do not necessarily represent the views of the Alpha Star Capital Management, LLC. The opinions expressed are subject to change without notice and do not constitute financial, legal, or tax advice. Please consult your financial professional before executing any financial strategy. Investment advisory services offered through Alpha Star Capital Management, LLC, a registered investment advisor. Alpha Star and ILG Financial, LLC are independent entities. SEC registration does not constitute an endorsement of the firm by the Commission, nor does it indicate that the advisor has attained a particular level of skill or ability.